You're watching Cetome TV. Knowledge is power.
All right. So Judy would like to know, and great question, Judy, is there some way that I can completely avoid cancer?
No.
What could I do? No.
Well, cancer is a disease of the aging. As we get older,
Okay.
what's thought, the general consensus right now is that the telomere caps that protect our chromosomes, they're little caps at the end of each chromosome. Apparently, what happens is they wear away over time, and so as you get older, your DNA gets more damaged. And once again, this feeds back to the Hayflick number. A Hayflick number refers to how many cells or how many times a cell can reproduce before it goes into pre-programmed death, apoptosis.
Okay.
So most cells have, a limit to how long they're going to live. And if they live much longer than that time, they're going to start losing genetic information and accumulating more mutations, and that's cancer.
All right.
So the longer you live, the more chances you have of getting cancer. So to avoid cancer would be to die young.
Let's come up with another option if we can, Judy. I'm not a big fan of that particular option. Okay, but the point is things are naturally going to degenerate over time, and that's where those mutations can start to occur and cancer can develop. Yeah. Okay. So if we weren't able to completely avoid it because we weren't ready for that option you just proposed, what could Judy do to do her best?
Well, definitely avoid smoking, avoid chemical exposure.
Okay.
Make sure you get as many vaccines as possible, and we'll discuss why that's important for cancer.
When we talk later about HPV specifically. All right.
Yes.
So if you're showing up a little bit later, have a look for that information. Yeah. Okay, but vaccines.
Exercise, of course. Okay. Start a mostly vegetarian diet by the time you're 50.
Okay.
And eat healthy.
Okay. So we can't necessarily completely avoid it, Judy, but Alex says if we take good care of ourselves, you didn't mention sleep, but that is a factor.
Yes, sleep definitely is a factor.
Mm-hmm. Yeah.
That's because I don't typically get a lot of it. So I'm not used to sleep.
That's true. You are burning the midnight oil often. Okay, so smoking, reduce chemical exposure, get all your vaccines, practice that good weight bearing and cardio exercise, and eat mostly vegetarian. And that's kind of each of us as individuals doing our best to prevent cancer.
Exactly.
Got it. The other thing that can be really helpful there that, we talk about with our clients a lot is having inherited mutations testing.
Totally. Yes.
Right?
Yes. You want to be aware of that.
Yeah.
Yes.
So Judy, if you wanted to find out, if you were perhaps at more risk than others of developing cancer, or if there were certain foods or things that you should really avoid or have more of, a good inherited genetics test would really help, and Alex will be able to steer you in that direction.
Yeah, and I think you just came up with a great point that leads on to another point.
Oh, what's that?
Well, there's a recent study that showed that. Now, we've known this for quite a while, that the cancer patients that have mutations in a gene called ATM, it's a DNA repair gene.
Okay.
When patients have mutations in this gene, it repairs DNA. So what happens is then these patients have a heightened sensitivity to radiation. So the radiation will initially cause their cancers.
Got it.
So you want to be tested for ATM. But the surprising outcome of this is that when these patients get treated with radiation therapy, they respond way better than people that don't have mutations in this gene.
So that heightened sensitivity helps you.
It helps cause it, and it helps get rid of it.
Right. So So having a test to see if you're carrying any of those commonly known inherited mutations could help you avoid the development of cancer as well, or get more effective treatment.
And that's one of the genes that we would routinely test for in an inherited panel.
Right, ATM. Yeah. Okay, great. Thank you. Thanks, Judy.
Thank you for watching Cetome TV. Subscribe below and stay informed.